Thank you for joining me today as we talk about medication adherence. So what is the objectives of our talk today? It's to describe medication adherence in the United States, explore the factors involved with medication non-adherence, and identify strategies for improving medication adherence. So what is this? It is a patient's conformance with the provider's recommendation for a prescribed medication with respect to timing, dosage, and frequency of the medication. A similar term, compliance, relates to a patient's following of a provider's orders, and then the concept of persistence, which is how long a patient complies with the medication from start of the medication to completion of therapy. A slightly more human or patient-oriented definition, I would say, is this active, voluntary, and collaborative involvement of the patient in a mutually acceptable course of behavior to produce a therapeutic result. So again, a little more patient-inclusive in this definition of adherence. So let's describe the current problem in the United States. Up to 157 million by the year 2020 will be affected by at least one chronic condition requiring medication therapy. And we know that about 20 to 30% of prescriptions are never filled, and 50% of medications are not continued as prescribed by the physician. Medication adherence also drops after the first 6 months of the therapy. So what are consequences of non-adherence, or why should we care? Non-adherence results in 30 to 50% of treatment failures, so a patient not being able to complete the therapy, and up to 125,000 deaths annually. It increases the risk for hospitalizations, emergency room visits, and has both indirect and direct costs of up to about $300 billion per year in the United States associated with non-adherence. So how do we assess whether or not a patient is adherent to the medication regimen? There's direct observation of a patient. There's measurement of blood levels of the drug or drug metabolite, measurement of a biological marker in the blood, say cholesterol or blood sugar. Then there are indirect measurements, like a patient fills out a questionnaire or they self-report. There's actual pill counting. If a patient should have used 60 pills and only 10 are missing from the bottle, obviously they didn't take 50 of the pills. Similarly, rate of prescription refill. If they are supposed to be filling it every 30 days and they're only filling it every 90 days, you know they're not taking the medication as prescribed. You can also look at a patient's clinical response or measure physiologic markers. Patients may keep a diary, or there are also electronic medication monitors. The World Health Organization has this unique quote, which I thought was very interesting. Increasing the effectiveness of adherence interventions may have a far greater impact on the health of the population than any improvement in specific medical treatments. So if we only did better with what we have, we could be treating people more effectively even without new drugs. So what are some reasons for non-adherence? There are intentional and non-intentional reasons. So a patient may voluntarily choose to deviate from the regimen, or it could be a more passive process where a patient may simply forget or may not be capable of taking the medications as prescribed. So many different people are involved in this. The healthcare system itself. Potentially there's a lack of training for healthcare providers or poor quality of provider-patient relationship. There may be poor communication or judgmental attitudes when a patient is being seen and cared for, or a patient may have lack of access to healthcare or a lack of ability to follow up with the prescribing physician. There are also therapy-related factors. If the medication regimen is simply too complicated, too many drugs, too many side effects, they may not be able or willing to follow the medication regimen. So simplification of regimens is key. There are also socioeconomic. Maybe the patient, can't read the materials they're given or don't understand what they've been told to do. Maybe the family is not supportive or able to help the patient follow through on their medication adherence. Perhaps there are really high co-pays, or they can't afford the medication, or maybe they can't afford to have it, consistently. There are also condition-related factors. So a person may not feel sick, they may not think that they need to continue taking a medication, so they don't. Or the condition itself may be a mental health disorder, and it may be a barrier to them taking the medication as prescribed. There are also physical impairments. Some people may have trouble opening the actual pill bottles, or maybe mentally, Alzheimer's or something like that. They may forget to take it. There are also psychological or behavioral issues, and we know that people that are younger age and non-white race tend to have less medication adherence. So how do we improve adherence? So all those factors we just described, we have to involve all of those in making a true breakthrough. So some basic strategies: simplify the pill regimen. Try to reduce the number of daily doses. The care provider can use motivational strategies with the patient. They can sit down and say, okay, will this work for you? Involve the patient in the plan and make sure that it's something they're actually willing to do. There are special medication packaging that they can use, little pill blister packs that help the patient visually see, and they'll have the date listed on it, or there are pill boxes that can be used. You can set reminders in your smartphone, or you can keep a little daily calendar. Patient education, and again, just reinforcing with them the importance of taking it. Monitoring and feedback. We know that when patients have a follow-up appointment coming, they tend to be more compliant as they get closer to the day of their appointment. So having frequent follow-up, if not in person, by telephone, and then communicating effectively and in the language that the person uses. So slightly more psychological strategies would be reduce the stress around a healthcare visit. See if you can address any life events or stressful events that are happening with the person. You can help talk them through or help them work around. Improve the provider communication skills. So could the prescribing person make the encounter a little bit more comfortable and more easy for the patient to understand? Again, involving the patient in the medication planning, providing some empathy and understanding of what's maybe a barrier for them and not being judgmental. Try to normalize medications that may have a social stigma, so like pain medications or psychologic medications, letting them know that it's okay and it's part of their treatment and will help them. So there are also several aids that can be used, and some of them, since we're in Silicon Valley, we must talk about some of the tech aids coming up. But there are things like contracts where you can get a patient to physically sign that they're able to they are willing to agree to take their medications. Or here, I will walk with my daughter down the aisle. I will grow old with my husband. I will do that by taking my medication. So they take this pledge. Again, the electronic tools, so you can have there's iPhone apps or smartphone apps that can help remind you. You can get points for doing them. Over 150 apps are used to help people take their medications. Vibrating alarms, pill dispensers linked with your computer. So lots of cool tech strategies nowadays. But again, it'll take the prescribing provider to help motivate the patient and lead them to these things. Here are a few more electronic things, and there are many more than this. And so that is a brief description of medication adherence and some of the psychological components. Thank you.